Hi, I'm Ryan Marshall, the Program Manager of the Quick Response Team.
And I'm Lindsay Kensinger from St. Petersburg Fire Rescue. We want to provide education on what the Quick Response Team is and how to refer patients and when to do so.
The Quick Response Team, or QRT, as you'll hear us refer to it, is a partnership with Pinellas County Health and Human Services that originated in September 2022 via SAMHSA grant. We have teams of case managers and peer support specialists to respond to referrals where individuals have recently overdosed or are presenting at risk for an overdose. At the time of the program establishment, our referrals came from local law enforcement agencies. However, we've expanded to take referrals from EMS as well.
Ryan, what are some reasons why our EMS clinicians would refer their patients?
We can work with individuals who have recently experienced an overdose or, again, are presenting at risk factors such as known substance use, including those beyond opioids, such as alcohol or other stimulants and depressants. Examples of appropriate referrals include responding to an individual that has recently experienced an overdose, has a known history of substance use, or an accident call that originated from suspected substance use.
What type of services can be provided to the patient when referred to by EMS?
When we receive a referral, they'll be assigned to a team that'll reach out within 24 to 48 hours. We'll provide them with ongoing support, outreach through a certified peer support specialist. A peer support specialist is an individual who has lived experience of mental health or substance use challenges and has received training to provide support to others facing similar issues. They combine their personal experience with professional training to offer guidance and encouragement. Peer support has demonstrated positive impacts on various health outcomes. Studies show that peer support can lead to increased self-esteem, reduced hospitalizations, and improved engagement with services. Peer support is particularly effective for reaching individuals who are typically hard to engage with traditional services.
Ron, I imagine that being referred to QR team could be fearful for some of our patients. Are there any individuals that can help with any resources or treatment options?
Yeah, so we also have case managers to help individuals navigate the system and enroll in treatment services. We can provide naloxone kits and education for their use. We also provide support and resources to family and or support of others to help aid the patient in their recovery journeys. These services are provided at no cost to the patient. While the ultimate goal is to assist them in getting into treatment services, we can work with individuals wherever they're at, even if they're not ready yet to take that step. We've received over 1,000 referrals since the program's inception. A significant portion of the patients we work with may be transient or homeless. While that sometimes makes outreach challenging, we've found that the most helpful information to include beyond contact information is a physical description, last known whereabouts, and areas frequented. Providing information for a supportive other is also helpful in these circumstances. Patients can be referred whether or not they were transported by EMS.
So now I want to explain how our EMS clinicians can refer their patients directly in their patient care reports. While in your patient care report, you will select the tab Community Health on the left-hand side. This provides a drop-down menu with the options for SUD QRT Referral. After the patient has agreed to the referral, select Yes to indicate the patient wants to be referred. You will notice a close call rule will appear, prompting you to enter the patient's phone number. You can also enter the patient's email address in the narrative or ensure that the patient has a correct address. As a reminder, you must enter their phone number for the referral. Once your report is posted, the referral is sent over to the Quick Response Team.